Dr. Brenda Malka here. If you decide to go to an acupuncturist for your jaw pain or your TMJ dysfunction, I want you to know what to expect. The muscles they'll be needling will be this masseter muscle that attaches from the cheekbone to the jawbone, and that's a chewing muscle. And the other muscle is the temporalis muscle, that's also a chewing muscle. And both of these muscles can create trigger points that go into the teeth to cause kind of teeth pain or aching. The first muscle I'm going to do acupuncture on is that masseter that I just showed you in the picture. Attaches here and comes down. So I'm going to find the edge of it. Just put the needle in like so. And this is what your acupuncturist would be doing also. And these needles are 1.5-inch needles because we're dealing with a fairly large muscle. And the final needle is a 1/2-inch needle, but a somewhat thicker 1/2-inch needle. And I'll just go right into the muscle belly. And I'll continue with the other side. Once again, dropping off this way to where I feel the beginning of the muscle. You can see 1.5 inches and it goes all the way in the whole muscle belly. And this thick part right here, just one 1/2-inch needle. Now acupuncture on the temporalis, this fan muscle, starts here, comes around and attaches to the jaw. Also helps with closing the jaw. And start off with 1/2-inch needles that are a little bit thick, because this area of the muscle down in the lower area is a thicker aspect of the muscle. And we're putting the needle in at about 45-degree angle. Now for the rest of the muscle, I can feel it moving. You can probably see it as I'm talking. Now you really know what this muscle does, right? Because as I'm moving my jaw up and down, these needles move. So the rest of the fan, I'm still going to continue with 1/2-inch needles, but these needles are going to be thinner needles, just because these muscle area on the edge of this temporalis is thin. And if your acupuncturist finds any trigger points while he or she is touching, massaging, palpating the area, that's really where you want the needle to be in. A little hard to see here because there's a little bit of more hair there. All right. And so this side's going to be a little better to visualize. Once again, the bottom of the muscle's thicker. So I'm going to be using a short but a slightly thicker gauge needle. Again, 1/2-inch needle, but thick. Sometimes these little guys can be difficult to work with. But that one's just not going to cooperate, so we will just move on. And again, where this area fans out, I'm going to be using still a 1/2 inch needles, but with a thinner gauge. There is a technique in acupuncture that's called kinetic acupuncture, where the needles are in and they actually have you move around with the needles in order to stimulate the needles. And here we go. Time to take them out. Feels so good. You want to maybe massage these out. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos. To allow me to make more videos for you in the future, please press the subscribe button, press the notification button so you don't miss a video, and press the like button, and be sure to share with your friends and family.